What if I told you there is a healthcare career where many professionals earn around 6 to 15 lakhs per annum without having to treat patients or opening a clinic or having to work night shifts? But wait, is it really possible? Totally yes. I'm talking about clinical data management. And surprisingly, most B.Pharm, PharmD, BDS, MBBS, nursing, biotechnology, and life science students have never even heard of it. Before we begin, a quick introduction about myself. I'm a healthcare data analyst and digital pathologist. I work with healthcare datasets, medical image annotation projects, NLP based healthcare workflows, and AI training data. So, when I talk about healthcare data careers, you know that it's coming from industry experience and not just internet research. Now, let's understand clinical data management in the simplest way possible. Whenever a pharmaceutical company tests a new drug, thousands of patients participate in these clinical trials. Every patient generates important information such as lab reports, medical history, side effects, and treatment outcomes. But here's a question: if the data is wrong, incomplete, or poorly organized, can regulators trust the results? Of course not, right? That's why clinical data managers exist. Their job is to collect, review, clean, and maintain clinical trial data so pharmaceutical companies can make accurate decisions and submit reliable results to regulators. Think of them as the quality controllers of clinical research data. Now, many students think this is just data entry. It is not, because modern clinical data management involves working with clinical databases, electronic data capture systems, data validation, query management, and regulatory standards. So now let's talk about career roadmap and how can a beginner enter into this field. The roadmap is actually very straightforward. First, learn the basics of clinical research and good clinical practice, which you know that it is also known as GCP. Second, understand clinical data management concepts like case report forms, electronic data capture systems, and data cleaning. You don't need to become an expert initially, you just need a solid foundation. Third, develop technical skills. At minimum, learn advanced Excel, Python, SQL, basic statistics, and Power BI. These skills can make your profile much stronger than the average applicant. But many professionals stop at clinical data management. But if you combine clinical data management with analytics skills, your opportunities become even much larger. Step 4 would be to build project experience. Don't wait for a company to give you experience. Create sample projects. Analyze publicly available healthcare datasets. Create dashboards. Practice data cleaning exercises. Document your work on LinkedIn. Employers love candidates who show initiative. So, yeah, that was it about the roadmap. Now let's move on to discuss about salaries, because I know many of you are waiting for this section. Freshers typically start around 3 to 6 lakh per year depending on their skills and company. With a few years of experience, many professionals move into senior roles earning around 7 to 15 lakh plus or even more annually. And the best part, clinical data management can open doors to other careers like healthcare analytics, pharmacovigilance, regulatory affairs, clinical operations, and even healthcare AI. This is why I personally like healthcare data careers. You're not locked into one path, you can evolve as technology evolves. And speaking of technology, Do you think AI will replace clinical data management? My answer is no. AI will automate repetitive tasks, but healthcare data still requires human review, validation, regulatory understanding, medical judgment, and quality oversight. The professionals who understand both healthcare and data will become even more valuable. That's why learning data skills today is one of the smartest investments healthcare students can make. Now, you're probably wondering which companies hire for these roles. Some major names include IQVIA, Icon, Cognizant, Accenture, Novartis, TCS, and several pharmaceutical companies. If you are a healthcare student who enjoys technology, data, research, and problem solving, do not limit yourself to a traditional career options. Healthcare is becoming increasingly data driven, and professionals who understand both healthcare and data are becoming more valuable every year. So, yeah, here's a question for you. Would you rather spend your entire career dispensing medicines at a counter or work with global pharmaceutical companies developing future medicines? Comment below. I would love to hear your thoughts. Thanks for watching, and I'll see you in the next video.